This is how much the Sanders, Ocasio Cortez Medicare for All bill would cost. It's insane. Now this here is why the socialist way never works. The socialist senator from Vermont, Bernie Sanders, has now come up with a new plan to provide Medicare for all. His most recent harebrained scheme is essentially a government-run single-payer healthcare program which has already been proven to be a failure in places like Great Britain and Canada. Under the senator's new plan, which of course is supported by the so-called rising star of the Democrat Party Alexandria Ocasio-Cortez, who is a self-professed socialist and is running for a House seat from New York, every American would get health care for free. But here is the kicker. Guess how much this scheme would cost the American taxpayer to provide this free service to the whole nation? According to Mercatus Center at George Mason University, $32.6 trillion over the first 10 years, and who knows how much more thereafter. This would mean the average U.S. taxpayer would have to pay double the tax bill they currently pay to be able to sustain this program. Let that sink in for a second. Here is more on this via the Daily Wire. In 2017, taxpayers forked over $3.32 trillion to the federal government, more than twice what they paid just 20 years before. If you're wondering what that number looks, it's this: $3.320 billion. The government, of course, overspent again in 2017, shelling out at $3.982 trillion, creating a $666 billion budget deficit. Now comes Senator Bernie Sanders with a new plan to provide Medicare for all, essentially a government-run health care program. Under the plan, heavily supported by the rising Democratic star Alexandria Ocasio-Cortez, running for a House seat from New York, every American would get health care for free. Guess how much free costs? Try $32.6 trillion over 10 years, according to a new study. That averages out to $3.26 trillion a year, almost exactly what the government took in last year. That's if the new plan took effect in 2022, according to a new study released Monday by the Mercatus Center at George Mason University. All U.S. residents would be covered with no copays and deductibles for medical services. The insurance industry would be relegated to a minor role, ABC News reported. Enacting something like Medicare for All would be a transformative change in the size of the federal government, said Charles Blas, the study's author. Blas was a senior economic advisor to former President George W. Bush and a public trustee of Social Security and Medicare during the Obama administration. With the cost of the free Medicare program nearly equally the amount of tax revenue, it doesn't take a genius to figure out that Americans would have to pay roughly double what they pay now in taxes. But Blas' study found that even that wouldn't be enough. A doubling of all currently projected federal individual and corporate income tax collections would be insufficient to finance the added federal costs of the plan, because the program's cost would grow rapidly. Several 2020 hopefuls, including Senator Kamala Harris, DCA, and Senator Elizabeth Warren, DMA, support the plan, as does Ocasio-Cortez, who defeated House Democratic Caucus Chairman Joe Crowley, DNY, last month and quickly became one of the top voices in the party. Sanders took issue with the study by the Libertarian Group, saying it receives some funding from the conservative Koch brothers. If every major country on Earth can guarantee health care to all, and achieve better health outcomes, while spending substantially less per capita than we do, it is absurd for anyone to suggest that the United States cannot do the same, Sanders said in a statement. This grossly misleading and biased report is the Koch brothers' response to the growing support in our country for a Medicare for All program. But Kenneth Thorpe, a senior health policy advisor in the Clinton administration and a health policy professor at Emory University in Atlanta, said the Mercatus study is accurate. It's showing that if you are going to go in this direction, it's going to cost the federal government $2.5 trillion to $3 trillion a year in terms of spending, Thorpe said. Even though people don't pay premiums, the tax increases are going to be enormous. There are going to be a lot of people who'll pay more in taxes than they save on premiums. Of course, Sanders took issue with the study by the Libertarian Group, whom he accused of receiving some funding from the conservative Koch brothers. But his argument was quickly squashed by Kenneth Thorpe, who was a senior health policy advisor for the Clinton administration during the 90s and currently a health policy professor at Emory University in Atlanta, who said the Mercatus study is accurate. See? This is why the socialists and communists always end up failing. Like Margaret Thatcher said, there comes a time when you just run out of other people's money. Just ask yourselves, If you're stuck paying double in taxes than what you are currently paying, is it even worth getting up every morning to go to work?